Yes, my name's just Dr. P. Hello. And I'm a family medical practitioner in Queensland, Australia. Just going to do a little video on a rare tumour called Pheaochromocytoma, which it's rare, but you know most doctors probably see one or two in their lifetime, and fairly serious condition. It's actually a tumour. Well, usually this is the usual thing. They can occur in other sort of places, but usually occurring in the adrenal glands. The adrenal glands sit on top of the kidneys, which was called the renal. The kidneys are renal. This is adrenal, so they're on top of the kidneys. The adrenal glands, which produce adrenaline, and most people sort of understand a little bit about what adrenaline is. Adrenaline being the chemical that really hypes up your system. I suppose it's those horses over there. Adrenaline's the fight or flight hormone. So if you see a snake or you know someone comes at you with a gun, you're going to get a massive surge of adrenaline produced by your adrenal glands, and that's going to make you ready to run fast, pump up your sugar, pump up your heart rate, pump up your breathing, get you very nervous and anxious. So that's what adrenaline does. But these tumours, pheochromocytoma, actually secrete adrenaline in far higher rates than the body is supposed to secrete them, and hence that's where the symptoms come from that lead to the diagnosis. They're often very hard to diagnose because a lot of the symptoms just look like anxiety. But your typical symptoms, if you've got one of these tumours, which are rare, are intermittent severe headaches because the adrenaline really pumps up the blood pressure. Palpitations and sweating, and palpitations being the heart sort of racing and going into a funny rhythm. Sometimes just going too fast, which we call a tachyarrhythmia. So tachy meaning fast. Sometimes going into atrial fibrillation, which is where the heart's beating in a irregular but fast rhythm. But often just pounding heart. That's what adrenaline causes. So if you get a surge of these chemicals from the tumour, you get that. You get excessive sweating, and you get excessive anxiety. You get all the sort of psychological problems of having too much adrenaline. Diagnosed, hard to diagnose. Your doctor's got to be onto it and think that it could be a possibility if it's occurring over and over. But you basically, I think they've probably got new ways of diagnosing it now, but it used to be 24-hour urine collection, and then that 24-hour urine collection would be measured to see how much adrenaline, or what they call catecholamines, which is the laboratory term for adrenaline, is secreted in your urine. If it was way above a normal level, then they would then think, well, yes, you could have this tumour. And then you'd probably go for CT of the abdomen to look at your kidneys. They probably do MRIs now, which are going to be more sensitive. They might do PET scans, which is another sort of scan to see if there's abnormal metabolic activity in any organ in the body. If they find that you've got one, if you were to have a tumour in the adrenal gland and that was causing those symptoms, then you're probably going to be up for surgery. So that's very tricky surgery, probably done by the very smart surgeons, probably done by endocrine surgeons, I suppose. But they'd probably need to really have you dialed in with all the medications to slow down your adrenal system before they give you an anaesthetic. So you're probably going to be given all the blockers of adrenaline, which are beta blockers and those sort of things. Then you'd have your surgery, have your little tumour removed, which is a bit tricky. So they probably don't think it is. And then you are cured. So that's what a pheochromocytoma is. Thank you.